Hello, my name is Dahlia Perez, and I will be talking about the healthcare in Germany and comparing that to the US. The type of healthcare system in Germany is very similar to what we have here. Both countries require that all citizens and legal residents have health insurance. The biggest difference is that in the US, we will charge a penalty if you do not sign up. In Germany, they will retroactively charge you for the entire length of stay that you didn't have health insurance. Their most common system is called the statutory health insurance system. About 84% of residents have this. Only 11% sign up for the private health insurance. As far as the population health, they're very similar between the two countries. However, Germany's smoking rate is a lot higher. About 21,000 per 100,000 adults report daily smoking, and in the US, their counterparts are 13,000 per 100,000. Their infant mortality rate is a lot lower than ours. It's about half. They reported 320 per 100,000 infant deaths per live births in 2016. In the US, we have significantly higher at 587 per 100,000. Their life expectancy is also a little bit longer. They live for about 2.5 years longer than we do on average. Both men and women report higher life expectancy. For those outcomes, they're paying a lot less. Germany's healthcare spending per capita is just over $5,000, whereas in the US, we're spending over $9,000 per capita. So that's about 1.8 times more. The out-of-pocket healthcare spending, it follows the same pattern. We are spending about 1.5 times more out-of-pocket than citizens in Germany. Their hospital admissions for asthma are about the same as they are in the US, but the annual flu shot seems to be a bit of an issue there. Only about 36,500 per 100,000 of their 65-plus-year-olds received their flu shots in 2015. In the US, we had about 69,100 per 100,000 with their flu shots in 2015. Germany has a really good program set up for their chronic disease prevention efforts. They call this the disease management programs, or DMPs. The DMPs were established in 2002, and this is a national level approach aimed at improving the coordination of care and strengthening the role of the primary care provider. They attack this on two fronts. They give financial incentives to providers, and they also offer patients self-management support and chronic disease management education materials for free. In the United States, we do have the CDC, who outlined the 4 domains of chronic disease prevention in 2014. These are really good recommendations that target environmental approaches. They talk about epidemiology and surveillance, community programs linked to clinical services, and also healthcare system interventions. In 2012, the USDA mandated that we all have to update our nutrition standards. So this tackles childhood obesity, which is a risk factor for cardiovascular disease, type 2 diabetes, and overall lower health outcomes. So by targeting children, they're improving the health of the nation and encouraging healthy habits. Germany also has significantly lower youth marijuana use than we do. We have about twice as many youth using marijuana in 2015. Their outdoor air quality is a little bit worse than ours. The air quality is measured in 2.5 micrograms per cubic meter. Theirs measured at 14 in 2015, and ours measured at about 8.44. And their global food security index rating is just a little bit lower than ours. They still ranked pretty high at number 7, but the US ranked number 2. Something I found interesting about this was that both countries reported having a 5% prevalence of undernourishment. So we ranked it the same as far as that goes. The behavioral health needs in Germany are significantly lower than that in the US. They have less people reporting treatment in mental health facilities, but they have way more facilities to treat those people. And also, as we talked about earlier, 0% of citizens and legal residents are uninsured because they do those retroactive charges. Whereas in the US, 12.5% of people ages 18 to 64 reported having no insurance in the 2015 calendar year. Their teen mom teen birth rates are significantly less than ours, actually more than, we have more than twice as many teen moms in the U.S. as they do, reported in 2015. Our graduation rates are about the same, and the unemployment rates are also about the same. So the key takeaways from this, when comparing the two countries, Germany spends a lot less than we do, but has slightly better health outcomes. Big ones to mention are the teen birth rates, significantly less than that of the U.S. Their infant mortality rate is also significantly less. Also, in addition to those things, a lot less people in Germany face cost-related access barriers. So these are things like skipping a doctor's visit, skipping doses, and refusing treatment or follow-ups due to inability to pay. Also, their behavioral health, Germany has about half the mental health patients, but 15 times more facilities to treat those patients in. Their homicide rates are also significantly lower. They have 0.85 per 100,000 homicides, whereas the U.S. has almost 5 per 100,000. So thank you for listening. These are my reference slides, and have a great weekend.